Megaloblastic anemia. So, megaloblastic anemia is this blood condition where the bone marrow, which is like the body's blood factory, starts producing these wonky-looking red blood cells. These cells have a funky nucleus that develops too slow and looks all lacy and weird. Most of the time, this happens because you're not getting enough vitamin B12 or folate in your diet. Why B12 and folate are big deals? Folate's job is super important because it helps make DNA, which you can think of as the blueprint for every cell in your body. Folate makes sure one of the main pieces needed for the DNA, thymidine, is around. B12 jumps in to help activate folate so it can do its thing. Without these guys doing their jobs right, making new cells gets all messed up. B12, what you need to know. You need just a tiny bit of B12 every day, and you can usually get this from animal stuff like meat, fish, eggs, and dairy. Veggies and grains don't naturally have B12 unless they've got some microorganisms hanging around on them. Once you eat B12, it pairs up with this thing called intrinsic factor in your stomach, then heads to your intestines where it gets absorbed and sent where it needs to go in your body. Your liver stores a bunch of B12, enough to last for years, so running low isn't an overnight issue. When B12 levels drop. Diet: vegans might not get enough B12 since it's mostly in animal products. Babies can also run into trouble if their moms are low on B12 and breastfeeding. Malabsorption: sometimes your body just doesn't take in B12 the way it should. This can happen for a bunch of reasons like gastric issues, surgery on your stomach, rare conditions from birth, intestinal troubles, inflammation in the stomach, infections, surgeries, diseases affecting the intestines, certain infections, and some drugs. Folate physiology. Folates consist of a large number of compounds derived from the parent compound pteroylglutamic, folic, acid by reduction, addition of single carbon groups, e.g. methyl or formyl, and, in cells, addition of extra glutamate moieties usually 4, 5 or 6 to form polyglutamates. Folates occur in most foods, especially liver and green vegetables. Normal daily diet contains 200 to 250 μg, of which about 50% is absorbed. Daily adult requirements are about 100 μg, body stores are sufficient for 4 months. Absorbed through the upper small intestine with conversion of all natural forms to methyl-THF. A specific protein is needed for absorption of all forms of folate. An enterohepatic circulation exists. Causes of folate deficiency. The most common cause is poor dietary intake, either alone or in association with increased folate utilization. Malabsorption occurs in gluten-induced enteropathy or tropical sprue. Increased utilization can happen due to increased cell turnover and DNA synthesis. Folate is loosely bound to protein in plasma and is easily removed by dialysis. Drugs like anticonvulsants and sulfasalazine, mixed liver disease, alcoholism can affect folate levels. Folate basics. So, folates are like a big family of compounds that come from folic acid. Imagine folic acid as the parent, and then it gets all these add-ons, think of them like stickers, which are bits like methyl or formyl groups. Inside our cells, folates get even more decked out with extra bits called glutamate moieties, usually rocking out with 4, 5, or 6 of them to form what's called polyglutamates. You'll find folates in lots of foods, but they really love hanging out in liver and green veggies. On a normal day, you're probably getting about 200 to 250 μg of folates, and your body's cool with absorbing about half of that. What messes with folate levels? The most common reason folks run low on folate is simply not eating enough foods that have it. This can be a bigger deal if you need more folate than usual, like during pregnancy or if you have hemolytic anemia. Not absorbing folate properly can also be a problem, especially with conditions like gluten-induced enteropathy or tropical sprue. Needing more folate than usual can also happen if your body's making cells like crazy, which happens during pregnancy, with hemolytic anemia, or if you have some severe chronic inflammation or cancer going on. Folate in your blood isn't super clingy to proteins, so it can get lost during dialysis. And then there's medication and lifestyle stuff. Certain meds can mess with your folate levels, like anticonvulsants and sulfasalazine. Folks with liver issues or those who enjoy their spirits a bit too much might also see their folate levels dip. So, think of folate as one of those essential health buddies, coming mostly from greens and liver, that your body needs to keep everything running smoothly, especially during those times when it's working overtime. B12 deficiency, what's up with that? Symptoms: it creeps up on you with signs of anemia, like feeling super tired. You might notice a bit of yellowing of the skin, mild jaundice, because your blood cell factory isn't working right. Your tongue might hurt or look weird, glossitis, and the corners of your mouth might crack, angular chylosis. In severe cases, it could mess with having kids and cause some changes in skin color. The big deal, though, is it can mess with your nerves, causing tingling in your feet, making it hard to walk straight, or even affecting your sight and mind. If you are pregnant, low B12 or folate levels could lead to some serious issues for the baby, like spina bifida. Sometimes, you might not feel sick but a routine blood test shows something's off. Lab stuff for B12 shortage. How does your blood look like? You'll see big, odd-shaped red cells and some neutrophils looking like they've got too many lobes in the nucleus. Blood tests might show high bilirubin and lactate dehydrogenase levels. B12 levels in your blood will be low, but folate might look normal or even high. Your bone marrow's working overtime but not efficiently, leading to big immature cells. So, how the clinicians suspect an abnormal B12 level? They may ask about your diet, any stomach surgeries, check for antibodies against stomach cells, which is called the intrinsic factor, and maybe even peek inside your stomach with an endoscopy. And take a biopsy of your gut lining. Fixing B12 deficiency. Treatment: they start with a shot of hydroxycobalamin in your muscle, repeating it a bunch of times and then once every 3 months for life, unless they fix what's causing the shortage. Or, they might go with high-dose B12 pills. Let's talk about folate deficiency. Symptoms: pretty much mirrors B12 deficiency, minus the nerve issues. Pregnancy: taking folic acid early on cuts down on risks like neural tube defects in babies. How do you know if you might be running low on folate? Tests: they'll look at your diet, any surgeries, meds, alcohol habits, and check for gluten issues or other absorption problems. Blood tests will show low folate but B12 might be okay. Treating folate deficiency. Treatment: you'll take folic acid pills daily for a few months, then maybe adjust the dose. This fixes the anemia but not any nerve damage from B12 deficiency. Pregnant women need to take folic acid to protect the baby from certain birth defects. Some places add folate to food to help prevent these issues. Other causes of big red blood cells. Besides B12 and folate issues, things like alcohol, liver problems, or certain meds can make your red cells big but not necessarily mean you have megaloblastic anemia. With alcohol, for instance, your red cells might get larger, but you won't see those weirdly shaped neutrophils, and your marrow looks normal. Big cells but not because of megaloblastic anemia. Other reasons for big red cells: alcohol, liver disease, thyroid issues, newborns, cancer treatments, bone marrow disorders, and a few others can all cause big red cells but through different paths than megaloblastic anemia. So, B12 and folate are pretty crucial for keeping your blood cells and nerves healthy, and there are a bunch of ways things can go sideways if you're not getting enough. Good thing is, with the right tests and treatments, it's often something you can manage or fix. And that's all for now. See you next time.